Okay, good morning, everybody. Just as a short introduction, so I have spent quite a lot of years in the last, well, actually the last decade living overseas, and I've just moved back recently to the UK, and I've been based in Asia. And the start of these studies actually was at a point in 2011 whenever I was working in Cambodia, and we were working in a clinic, and I had mum come in with twins, and she was breastfeeding, and the little boy, she was malnourished, she was not in a good place at all, her health was not good, she was exhausted, and she didn't have enough milk for both the twins, and so she was focusing on the little boy, which was very cultural in that context. And when she came in, the little girl was extremely ill, very high fever. She had been feeding the baby rice water, and the baby had been contaminated, so the baby had a very bad infection. And it was a light bulb moment for me when I looked, and I just thought the influence of culture on behavior is so powerful, and it can make such a difference. And that led into PhD and into further work that we're doing. And so this morning, actually, what I'd like to take a little bit of time with you is just to be able to talk about what we've been looking at and what we've been learning. So we've heard already just some of the benefits of breastfeeding, the attachment, the emotions that come with breastfeeding, the protection for both mum and baby. But particularly in the developing countries, actually, that protection increases so much more. Protection against infection, gastrointestinal, respiratory infection, all of that kind of thing as well. But one of the challenges that we still find overseas as well as here is actually that we get mixed messages. Mums get mixed messages from the health professionals, and they can end up in that dilemma of, well, what do I actually do here? And that can have real impact actually upon motivation and upon how they set goals and how they achieve what they want to do, which is the best for their baby and for themselves, and to breastfeed. And as I said, culture is one of those things actually that it has a real impact. And whenever you're looking at cultural influences, you can see the different layers and the different aspects that actually influence behavior. And these are just some of the definitions. The definition of culture has been an ongoing discussion and debate among anthropologists, social scientists, sociologists, and a range of people and a range of academics. But actually underlying it are those layers of depth that actually impact. And it's manifested at very many different levels. And I know for myself, having lived overseas, there's language, there's history, there are expectations that lie underneath the culture, that when you live within that culture, you know and understand it. But whenever you move into it, or you're moving around the culture and you're not as familiar with it, at times you trip into it. But those layers of culture actually have a massive impact as well on breastfeeding behavior. So part of what I wanted to do was actually look at that definition and those cultural influences within Asia, and particularly the impact on motivation. And you can see here, Asia is the largest continent in the world. It is such a crossroads of cultures. It's such a crossroads of nationalities and economic dynamics and so many different things. But one of the things that most people don't realize about Asia is actually that an awful lot of the countries, particularly in Southeast Asia, are also under military rule as well. So there is actually a very tight political, economic impact that is having an effect on communities, and particularly women and babies who are living in areas where they don't have access to things that we take for granted. And so I'm taking data from two studies that we've done. One is, as Marlene mentioned, is my PhD study. The other one is a study that we've done in the last 2 years. And this is just some of the details related to it. So our first study was done in an urban hospital in northern Thailand in a city called Chiang Mai. And it had good infrastructure. There was very good training. Thailand has a universal healthcare system, and it means actually that if you're registered in any way within the country, you have access to healthcare services for what they call the 30 baht card. So you pay 30 baht each time you go in to be able to access healthcare. And they had a large group of mothers coming through every day through the maternity unit in this hospital. And the focus in this study was actually looking at the education and the motivation and cultural influences within what was being taught. But we also did a maternal health study to look at the motivational influences and the motivation of mothers breastfeeding in that environment. The second study was in a remote area of Myanmar. It was in a place called Karen State in Myanmar, and it was much more rural communities living in a post-conflict setting, and actually 31 villages in 2 districts that we gained data from. And you can see there we had 244 surveys, and we did 8 focus groups, and the focus groups on average were between 9 to 11 people in a focus group. And these are some of the findings that we actually got from the surveys, first of all. So the average age in Thailand of a woman giving birth was around 27. And the barriers actually to healthcare were much more related to health literacy and to language. One of the things that we saw was for the ethnic Thais, they did have access to healthcare and to education and to the knowledge and expertise from the midwives. But if they were outside that language, if they were tribal groups in particular, then there was no language availability for them. That nothing was translated. And so they actually had much more reduced access. Interestingly, one of the things the survey showed was the very, very high value on breastfeeding. And breastfeeding was very much the norm within that context. And again, then in Myanmar as well, the average age was between 25 to 30. And although these were remote areas, once again, breastfeeding was actually a cultural norm there. It was something that it was just what they did. So within the Thai setting, one of the things that we saw was actually these were some of the reasons that were presented to the women through the education process of reasons why they should breastfeed. And I want to highlight this one down in the corner because this is actually something that goes right across the cultures. The concept of milk insufficiency is something that we hear quite often here in Northern Ireland, but you hear it just as much in remote areas in Africa, in Asia, across the board. Mums say, I don't think I have enough milk. And so that is actually something that whenever you're looking at motivation, it can be a huge motivational impact, but it's fascinating how it also goes across the cultural divides. And once again, within Myanmar, these are results that came out of Myanmar. And once again, actually, what you can see is that culture, it's a norm. And in both of these areas, there is a cultural context and a cultural concept, that is called the mother's milk debt. And they believe that when you breastfeed your baby, in the years to come, as you grow up and you get older, within the culture, actually, you owe a debt to your mother for feeding the baby. And there's both a respect and an honor that is given to mothers through this mother's milk debt. And it's one of those layers that is incredibly powerful when you look at it from a motivational perspective. But underpinning all of this is actually what we call community cultures. And I think one of the big differences that we're seeing, listening this morning and knowing the research and the information and the lessons that I've learned from living in Asia over 10 years, community culture is the very heart of Asian culture. It's very much about being a group, and it's about supporting each other. It's about actually being there for each other, learning together, and stories and lessons are passed through the generations and passed down. But it also gives some very helpful and very, very valuable other elements too. There's a built-in peer support within these cultures. Whenever you look at this in both settings, although the settings were so different, one was a remote area, one was an urban city, within both settings there were elements and there were moments within our data collection where you saw this community support. In Thailand, sitting in the lactation clinic, the women helped each other. They supported each other. It was like a breastfeeding support group within the context of a hospital. And women came and went, but they talked to each other. They helped each other. They connected together. And it was the same thing in the communities whenever we were collecting the data in Karen State. And they knew each other's stories. And they followed each other's stories. And they supported each other in the midst of that. And what we saw was that actually building these family structures and rebuilding these community structures actually rebuilds that support again for breastfeeding. And it's something that I think is transferable. I think as we look at the context that we're in within the West now, we have a highly individualized approach. We have a person-centered approach, which is appropriate for our culture. But in the middle of it, actually, I think there are transferable lessons that we still need to look at and we still need to learn. And that community culture, that rebuilding of that sense of community is something that is actually a barrier. Listening this morning and hearing about just people's experiences of feeding and being in public and the challenges that they face, actually rebuilding those organizational community cultures is such a key element of work that we need to do. We live in a global world. The reality is that even as I look around this room, I see that global world. And those global influences actually give us an opportunity to bring change in a way that is going to fit healthcare in an ideal world, where actually we have access and we offer access to healthcare that is both contextually and culturally appropriate in the situations and for the people that we're looking after. But we need a deeper understanding of those underpinning cultural influences and how they impact that motivation as well. And that's part of the journey that we're on as a research team. We have a partnership with Chiang Mai University and with Yangon University in Myanmar, and we're in the process of applying for a large-scale grant to look at increasing maternal health in 4 states now in Myanmar as well. And hopefully at a later date, we'll be able to share some of that with you. But a final thought, something that we can all do. Observation is such a critical skill, and it's something a lot of the time that we take for granted. But for us, for those of us who are nurses and midwives, actually observation is such a key moment when you see a woman who's struggling or you see education or something that's not working, to be able to step in. But for those of us who are passionate about breastfeeding, it's the same thing.